Entebbe, a very, very beautiful place you'd want to go to and check out over their services. Depend, of course, by the way, they are very, very friendly when it comes to your pockets. So find time and go to Protea Hotels by Marriott in Entebbe. Their contacts are down there. You can, of course, interest yourself in contacting them and see what they got for you. Majorly in this particular period. It is a very, very cold morning. You would want to go there and warm yourself somehow, somewhere. Well, today is a very, very good day, knowing the fact that the Ministry of Health came out and okayed the ban that was put on recruiting doctors. So it was okayed, and of course, so it is a smile, I can say, to the medical department, because this had taken on, I think, from 2019, and yes, we have not been seeing doctors being recruited, but this has been lifted, and of course the information about the lifting of the ban on the recruitment of critical staff in national, specialized and regional hospitals, and of course is contained in a February 19th letter by the Ministry of Public Services to the Ministry of Health. That is really, really good news, and that is why today we're going to be discussing how this ban on the doctors' recruitment will enhance service delivery, especially in the sector of medics. So, which is why today we're going to be discussing this with Dr. Kabweru Wilberforce, who is the ethics and the chair ethics and professionalism at the Uganda Medical Association. A very good morning to you, Doctor, and you're most welcome to Chat of Uganda Family TV.
Thank you very much, Mr. Alnetre, for hosting me. Good morning, viewers of Family TV. We are delighted to be here as Uganda Medical Association to share with you some part of our happiness. Yes, so, as already stated, early February this year, the PS of Ministry of Public Service actually released a letter which was showing that actually the ban has been lifted in recruitment of critical staff, and it came at a time when it was really already awaited for, and that is very important in the fact that we know that for the almost 5 years since 2018 we have not been recruiting staffs, but you know, in the life cycle of a health worker, you have training. Most of the health workers are trained for 5 years. Those are the doctors, and then the other cadres, the respective years. So after that training, they go for internship, and after that they need to be recruited. Okay. So there has been a good number of health workers who have been on the streets and not in public service. And obviously we have been aware that actually we have been having too many numbers of patients in the hospitals, that actually the workload has been quite hectically heavy, and the few health workers who have been in the respective health facilities, they could not cope up with the kind of work that was there. So this comes in the right time to make sure that actually we recruit more doctors and improve health service delivery in the entire country. So maybe if we are to draw back a little bit behind, what do you think was the cause of this ban? From what we read, the government was saying it did not have money to, first of all, sustain the big numbers of civil servants, of which health workers are part of this group. And obviously that is quite unfortunate, because we know that if you say you don't have money to sustain health workers, it's like saying that, oh, you've given up on the other population. You know that we are in the tropics, where diseases actually are always popping up here and there, and it means that when you have health workers, they actually, some of them reach retirement. There are a number of causes of attrition. Retirement is one of them. Some die off, and some others actually move off to other employments. So when you don't recruit for a long time, actually, because severe understaffing, and that actually hampers a lot in terms of service delivery. So it creates a lot of crisis in terms of delivering services. And even those people who remain, the secretarial staff, who I would call them secretarial because they keep on reducing. They can't keep on increasing. When you have age limits for how long someone should work. So it means that if you have health workers and some are dying off because of natural causes or other causes, and then some are retiring, some are actually moving on for other employments, which you cannot stop, it means that the number of health workers that remain in the system to work becomes small, and even the workload becomes high, because you know that every day there are so many patients that usually keep visiting the hospitals, and that causes a lot of challenges in terms of service delivery. And obviously, worse, that can also cause poor services that are being delivered. The quality reduces, and inevitably, sometimes even the death increase, and then obviously, the more complications also develop among the patients who are sick. Okay. And so the cycle is quite big and complex. Yes, sir.
So how hard did we feel the impact of holding recruitment of doctors?
Actually, you've been hearing engagements by different stakeholders, and the Uganda Medical Association is one of them that has been advocating for recruitment of health workers, because we know that actually this does not only hamper service delivery, but also impacts on the training, the quality of training. How most of these facilities or hospitals actually are training sites for the undergraduates, postgraduates, and then fellows, and even other doctors. So if that also becomes difficult, because the people who are meant to be there and pass on the skills, knowledge, and the good practices are not there, they are not adequate. So some of these places were not good places for training any longer. So with this recruitment, it means that we're also going to improve a number of sites that can carry on with the training at different levels, and that is very good. And the other thing is that even research was very difficult, because if you have so many people who are falling sick, and then you don't have adequate staff to find out what are the biggest causes of issues or what is changing. You know that health is a very dynamic. So that one also was being hampered. So it is a serious issue. So we feel like with the lifting of the bans, the doctors who have been on the streets are going to be employed. And then there are also doctors who have been working for some good years, 6 to 15 and more years in the system without moving from one level to another. Okay. And I remember early this year, 2024, Uganda Medical Association, we carried out a survey, and which actually showed us that actually we have 2,500 doctors that were still unemployed, and actually 60% of those were already eligible to become associate consultants. Those are specialists. And 25% were already eligible to become consultants, and 15% were eligible to become senior consultants. Now, those kind of cadres, the specialists, associate consultants, and then consultant and senior consultant are very key in service delivery, because that is the gist of the issue. Those are the people that make very high-end decisions in terms of service delivery, and actually that means that we are going to improve. Okay. So this comes in a time that it was awaited for, and we think that it should be actually exploited to the maximum.
Okay. Yes. And now the country currently, according to the PS sometime back for Minister of Finance, I came out and said the government doesn't have money. And we are seeing still in the medical sector, we are seeing interns who are having issues to do with the allowances not being increased and all that. So do you think there is money? Because one of the reasons, I think, for them to put a hold on recruitment was issues to do with money. So do we have the money to facilitate these ones who are going to be recruited?
That is a very political statement. Thinking there is money, it's like being in a home. Hey. When your father will tell you there's no money, you'd think, but why does my father go and work and every day he's coming back? So the other thing is that whether you have money or no, or you don't have money, there are now cycles that actually should be planned for. And actually, in terms of the internship and the residents, those are the people who are doing masters, Actually, government should just come up and improve on the Uganda Medical and Dental Practitioners Act and put the details and the nitty-gritties so that that act is improved, and at the end of the day, actually, there's a law that actually states that an intern during his training, for that, first of all, it's 1 year, and you have actually been training this person for 5 years, either on government scholarships or the parents who have been struggling to pay for this person, and now they have given you a raw material. I call them raw materials. They are the best, already polished, and your work is just to look after this person 1 year, and actually you go through that and is registered as a doctor. And those are low-lying fruits. So the government should not think twice or thrice that they don't have the money. Let them look for the money. You see, in this country, you need to look for the money. And that's world over. You need to learn to plan how many students you have each year that you're graduating, and then how many are at resident level, how many are at fellowship, even PhD and postdoc, so that at the end of the day, the issue of saying no money is another syndrome. When we have so many symptoms and they start saying no money, it becomes a syndrome, and that can actually hamper service delivery. So let us just plan in time so that when we know that interns are always there every year, and they have a permanent place in our cycle. I told you we go for 5 years, we go for internship, and then we are recruited, and then further training resident, and then even further training at fellowship level, PhD and whatever. So the government should be told, if it is aware, that actually this is a continuing cycle, and let us look for the money and plan for them better, and actually make sure, because there are a number of things that have been changing over time. The time I was doing my internship, I had accommodation in Mulago. I studied in Makerere. I had accommodation in Mulago, and we had an intern's mess where we would get meals, and actually I also got an allowance of 600,000. That was around 2000 there, 2005, that's when I did my internship. So if that time I got, I think, 600,000, and I had accommodation, and actually I had meals. Now the problem is that there are no longer accommodation units in most of these facilities. So that means that this intern has to move from where he's staying, and some of them are not staying in very decent places. And these are the people who are looking after your lives. You see, if you want to test life and say, just fall sick, just get a fever, flu, cough, and malaria, and you refuse to come to hospital, and you say, my dear, the next time you will not be on the air to deliver. So let us hold these doctors with utmost importance, because they look after the entire. They look after wananchi. That's the word that is known. Yes, because if there's no wananchi, then who will vote us into power? Of course. So these are very key important people. Let us look after them. And some of them are our children, some of them are our relatives, some of them are our friends. No, none of them is our enemy. So let us look after them and make sure that actually they have decent accommodation, decent transportation means. Let them have rest, and then also look after people when they are really energized. So let the government actually, the best would be, government should put an act and say every year through public service, when an intern is given his contract for 1 year, he's going to be paid this and this. And that is a normal process, so that we stop this business, that there is no budget, the budget has disappeared between here and there, and then it's very thin. Let us just be constant.
Someone said that there are too many.
Too many? It's like when you get a wife, and then you start having children, and you pray to have one, but God gives you 3. What do? Do you get a pang and kill off 2, and then you say, I wanted 1? No. What the best is, there are so many institutions that are mushrooming, and I know the government licenses them through National Council for Higher Education. So if you get an institution registering to train, then you regulate. Tell them that, oh, we expect you to admit this number of students for these courses. And you know, if you have one university, initially we had Makerere alone, then Mbarara, Gulu, and then Usetema. Now they are mushrooming every day. KCU, IU, and then others. So it means that the government should be aware that the more you get so many training institutions, the many products, but that should not threaten the government. You should restrict and know that this is the much I can manage, and then plan ahead. So they know, and they are registered. Is there any of these universities that is between Uganda and the Congo? It's not in the borders. It's within the confines of the country. So they are budgeted for, and that's the best.
Okay.
Yes.
And now the ban has been lifted. What changes do you anticipate majorly in the availability of health care services?
I think they are going to improve, because one of the most turning points or the game changer is having human resource readily available to work. So if where there has been space now, there's a human being, even those special machines that have been put in the regional referrals, like CT scans, they are going to be functional, because they are going to employ critical staff, from which some are radiologists. There are areas that have ICUs in this country and they are not been working, like the Jinja regional referral. And I think they are going to get critical care nurses, critical care staff like anesthesiologists and the rest. There are places like Moroto that don't have internists or physicians. They are going to get. So me, I'm hopeful that actually now we are going to see something that we have not seen for some good time.
Okay.
And I think that is a good gesture. And we thank the government for lifting the ban, and they should actually not just do it once, but they should always just release it a bit and know that the other people are retiring, because every day they retire. You just do a survey in the entire hospitals in the government. People are dying, people are retiring, people are moving on. And some of the people who die are health workers. They are not any different. We are all potential patients. So it means that actually we need to relieve that on, so that we don't again stop again. Otherwise, we don't want to cause those mishaps. We think we're going to move from one step to another in terms of improvement. We don't want to go back so many steps down.
Okay. So maybe for clarity, is it true that since 2018 up to currently, there is no medical doctor who has been hired in this public?
No, because we don't. There's nobody who is above the law. The only thing that has been happening that when one retires is replaced with somebody within the system. But you still create a gap, because you move somebody, you can't bring in another person who has not been in the system. So that has been a very big crisis. That's why you have seen that the staffing levels have been going down. Yes, and actually the average staffing norm in the public health service hospitals or facilities, it is between 21 to around 64 on average. That means if you have a staffing level between 21 to 60, it means the deficit the other way is between 40 and to 80, isn't it? Because in a hospital where the staffing level is 21, it means you almost have 79% no workers. It is a very big gap, actually. I've been sympathizing with the directors. They've been crying. We don't have staffs to deliver this. We don't have staffs in the lab. We don't have. Yet the patients are there every day, and you cannot give that kind of package to patients that we don't have this. When they are seeing very nice structures. Have you looked at most of these regional referrals, like Entebbe, like Kayunga? They look fancy, fantastic, even when you take aerial pictures. But then we want that also to translate into the services that is given to the patients.
Sure. Okay, that's interesting. And maybe let's talk about the quality of the services. How will the services improve?
I think quality-wise, it will improve in that if I've been in a day, if I've been seeing 200 patients, you know, when you're starting with one at 8, you're very energetic, you're very sober, you're doing all the tests, isn't it? By the time it comes to 2 p.m., wow, the energies are going down. By the time it is 5, you are very exhausted. So if you have more than 2 health workers or more than 2 doctors who are seeing this number of patients you have been seeing every day, I think the quality is going to improve a bit than what it has been, especially lately. So we think that will improve a lot. Yes, so we are very positive.
And do we have any particular areas or sectors that are going to benefit much from the recruitment?
I think It is not targeted recruitment.
Yes.
It is recruitment across all cadres, and it means that actually the human resource gap that has been highly felt, it is going to be covered in the entire hospital. So they are not saying that they are only getting people who are working in theaters, they are getting people who are on wards and the rest, but they are getting all kinds of health workers across the board, and that means that actually the improvement is going to be in all areas.
Okay.
Yeah, you know, we have some areas that are critically hampered, like critical care. If you look at for instance, if we take Mulaga at a time, and you look at the people who are working in ICUs, is very labor intense and extensive. So if you get workers and one retires, you may need to replace that one person with 4. So in this crisis where people have been dying, retiring, and it has caused a lot of stress, and even those people who are left behind work, then they actually their workload increases. So in such areas actually they will benefit, and we think that since people have been training here and there and they have gotten an opportunity, I think we are going to improve marketing.
Okay. And maybe for some specific services, maybe like the CT scan, maybe recently we had, was it the kidney surgery also being introduced? When were these people employed or recruited?
No, we have been actually, for the kidney transplant, we have been riding on the people who are in the system already.
Oh, okay.
And obviously that causes a crisis, but now it is going to help that they are going to recruit many. And I think the government also should interest itself, as I stated earlier here, that they should interest themselves and say, we're going to train. They have trained several specialists, but we want them to come back and do more training.
Okay.
And then we make sure that actually we now give high-notch services in the country. Yes.
Okay, so for purposes of clarity, maybe, so doesn't this hamper the service? Because if we have not been having things to do, like people doing surgery or for kidney, and then you just improvise.
No,
not bringing like specialists.
No, the people who have been training have been people who have been working in other areas like urology, like in, the one who have been in dialysis and whatever. So I think what happens that when you're doing something like a kidney transplant, you use the available resources, but you hamper a bit the other services that have been going. So with the lifting of the ban, that means you recruit more, and then you can use the people you have, you train more, and then you replace. So you actually improve in the long run. You don't hamper delivery.
Okay.
Yes,
and what do you foresee in terms of service delivery?
I think there will be a lot of improvement. Although, if you do it, that's why I'm saying, and I'm being very intentional, that this lifting of ban shouldn't be 1 quarter. You see, the month that are remaining to end this year is, I would say, March, April, May, and June. They are almost the last quarter, isn't it? So that money that has been released, if it's not consumed within this 4 months, we actually, I was on record that actually it shouldn't go to the treasury. Let it be pushed to the other financial year, and then we continue recruitment. Otherwise, if you recruit now and then you think, oh, I've reached heaven, you'll be shocked. Because they are natural forces, natural selection, whatever that occur. People die. Dying is normal. There are people who die always. And there are people who retire. There are people who move on and get employment elsewhere. You can't stop. Human beings, I told you, they're in a cycle. So when they move on or die or retire, and you don't replace and you say you have now lifted the ban format, you have stopped it, you will go back to the same status, if not worse. Yes.
Okay.
Yes.
And maybe talking about the systems, you know, we have a very, very doubtworthy, is it kind of nation? People do not trust the process or the system. How systematic is it? How good is the system of recruitment? Because we have issues of this one is connected to this one. They already know they are going to get opportunities.
Opportunity. The good thing that actually, you know, the directors of those hospitals, they know where the gap is.
Okay.
They are going to work with the Health Service Commission, which is a government agency that recruits, supervises, and also mentors and fires, disciplines the workers. So it's already work in progress. So I don't think that there will be any compromise. Those people are actually independent and they do the best work. I don't think that there's any director who is planning to recruit a relative. No, he doesn't. The relative doesn't have qualification. But if he has a right to also go and contest, because there are going to be opportunities. And there's a due process. The good thing that this time is even online. You apply online, they tell you attach this and the other, and then you're selected online. You don't need to go physically to the Service Commission. You're just here on National Social Security Fund bill. But you don't need to go there. So they tell you, you go to their website, Health Services Commission, you apply online, you attach. If you don't have papers, then you can't be taken up. If you have papers and they are up to date, then you qualify. And you have the required period of time for that specific job that has been advertised. You are free. And they tell you which cadres they need, qualifications, and then the experience. You are free.
Okay. So the health facilities
is recruiting a relative, no.
Okay.
Those people are also very professional and ethical. So we think the process will just be as it has always been. I think you have not heard the Service Commissioner of being sued 24 hours and they are giving their relatives. And once in a while there are people always who think that every system is always wrong, but there are systems also that are good in difficult times.
Okay.
Yes.
So health facilities should prepare for new people to come in their systems,
they
right?
They may not even be new. There may be people who have been even volunteering and they know them.
Okay.
Yes. The new ones, those ones who have been volunteering and for promotion, I think they should do the due diligence and then do what they expected to do and then give the process, they do whatever, and then we see how they can be taken up in the different capacities.
All right.
And across different cadres. Not for doctors alone, but even the lab people, the nurses, and then other support staff if they are within hospital that are needed. Yes.
Wow, interesting. The government has lifted the ban on doctors' recruitment. How will this enhance the service delivery is what we're discussing. And of course, Dr. Wilberforce has cleared the air. There is no gamba no go in the medic sector. So please, if you think you are suitable for those particular roles that will be advertised, please go on and apply. The system is very, very okay, as Doctor has noted here. We are still discussing much of this, and we're going in for a very short break and return immediately.
Issues at hand, powered by
Protea Hotel by Marriott Entebbe. Comfort and luxury at its best.
This is Church of Uganda Family TV, enriching lives. Issues at hand, powered by
Protea Hotel by Marriott Entebbe. Comfort and luxury at its best.
Protea Hotel by Marriott Entebbe there, of course, gearing the discussions here today. The government came out and lifted the ban on doctors' recruitment. How will this enhance the service delivery and, of course, in the medical sector? So it is very, very important to know what this will come with. That is why we have Dr. Kabweru Wilberforce, who is the Ethics and Professionalism Chair under the Uganda Medical Association, to discuss or to give us insights on what this particular policy or this particular move will do to, of course, better the service delivery in the medical sector. So it is important that you have joined us today, and of course, if you missed the first session, then you really missed a lot. But well, we are here, and you can get these clips or this particular session on YouTube, where the whole show is being streamed as well. So, Doctor, do you foresee any challenges or obstacles that come with this the recruitment of the recruitment system, and mostly what could be the future aspects of having, maybe not having a ban coming again on this doctors' recruitment?
I don't want to anticipate that there will be problems, because I know there have been a number of issues that have been around, and one of the things that, for instance, if you look at, I just want to draw you back during the time of COVID-19. We had some staffs actually who were supporting the CTUs, COVID treatment units, and you know, when their contract expired, they were laid off because the government did not have resources to actually recruit them and then put them on their respective jobs. So I think with this recruitment that has been lifted, that the ban has been lifted, we think those people who already, some of them actually were even interviewed, but they couldn't be employed because there was no finances to, there were no funds to look after their salaries or their remuneration. So I think it is timely that some of those will be reabsorbed, but even those ones who have been stagnating, they will move to other levels. And it is also important that actually we don't anticipate problems, but you know, sometimes the due course, you never know. Probably what I would say that maybe the money may not be enough. We don't know how many health workers we may be needing across the entire country, or the number may be huge, and that money is consumed in a short period. And then probably the other thing that I was already scared about, that actually if the financial, we don't know, because if the financial ends and we have not utilized that money, it goes to the treasury, it never returns. But that's why I was requesting government that please let it this be not a one-off, and we do at least each quarter in each financial year. That will go a long way to solve a lot of problems, even the unanticipated challenges. So let us just be optimistic and be positive that actually this is going to yield the best for the country.
Okay. So in what ways can the government collaborate with the healthcare institutions to have an effective recruitment process and, of course, deployment of these doctors?
Actually, as I alluded to earlier, since the government is the one actually that gives license here to most of these training institutions for health workers, let it take the responsibility to also regulate the numbers that are admitted to those facilities, and then also put measures like exams, standard exams at different levels, so that at the end of the day, all the doctors that come from all those institutions and other health workers are actually able to be employed without any question, and they are at the same level. And also they can also be, if we think we have a lot of health workers in this country, then they can always be externalized. That means they can always go outside Uganda and get employment. We know there are countries that don't have medical schools, or they have one or fewer, and this resource is actually already available. So we will employ government to collaborate with those training institutions, and even during recruitment, let it actually recruit most of its products, because if you have doctors you have trained for 5 years, 3 years, and more years, then they are available to give a service. Please take them up, because the more you actually delay, the more people will move on to other places. But also we know that with industrialization, we are going through that phase of industrialization, and we also anticipate the oil and the gas industry to boom. So there will be a lot of improvement here and there, but also there will also be need for health workers in the different sectors. So government should, I think, collaborate with those institutions, but also with those stakeholders, like Total Energies is already doing supporting emergency training in Mulago. That's in Makerere. So I think they can even support in terms of recruitment, and then even support in terms of even remunerating. Sometimes if you can't, if you feel you're overburdened, then you can involve them. Some of them actually will even need units like in Hoima to support them. And I think that's why even Hoima had almost 9 billion for recruitment. It's a big place. It's not in the regional referral only, but that entire area, the Albertine area. So I think it's a good strategy. And you remember, we have also been losing so many doctors of late. We lost Dr. Biliga, and then we lost also the one of the doctors in the same area. So those gaps need to be actually filled, and then also we need to think ahead of us. And we know with the advances in the health sector, it means we need more training, further training, and specialized training, and then more training. And then obviously, if those services are brought here, then it means that we need also to support them and recruit people, and also be paid on their jobs. And that also can go alongside to reduce on the tourism, whereby you keep referring patients outside your country. I think it should have been earlier on attained, but now it is not. It is getting out of hand. That actually, after being available for a while, we shouldn't be transferring patients that can be managed like in Mulago Women's Hospital, Kawempe, Chirudu, to go and get the services outside. Actually, we incur a lot of costs. We don't stop the government, but it would be more better that if that money that is spent on people going abroad is put in here for capacity building, and for making sure the services are available, the drugs, appropriate drugs are available all the time. Actually, we would cut down a number of costs, and we would be moving towards the high end. But the more we take those people out of the country, it means the more we spend, and the more we go down or we remain stagnant, while the other people are using our money to move ahead. So I think it is better we use that money, use it here appropriately, and we shall get the best out of it.
Okay. Are there any specific measures that are going to be put in place to ensure a transparent and fair recruitment process?
That one, I already told you, there is a Health Service Commission is actually a government, I think it's a government non-parastatal, which has been there for ages. They are very independent, they are the most ethical, and they have value to whatever process they are going. They have been diligent. They are actually the experts. Even me, at all levels, I was recruited as a medical officer special grade, that is an associate consultant. I was promoted to consultant, and I was promoted to senior consultant through the same. Even my teachers who have been there before. So we have a lot of trust in Health Service Commission that actually that institution is independent and is not compromised, and they have been doing it, they are going to do it, and they will do it even in the future. So for us, we trust it 100%, and we are sure the jobs will be available, and they will be through the due diligence.
Okay, will this lifting of the ban contribute somehow to the training and professionalism of health workers?
Every time you actually move from one level to the other, there's always more training. For instance, if you're a medical officer, we know that you have gone for 5 years, you have done your internship, you're a medical officer. Now, if you go back and get more training in terms of as being a resident, that means you're doing your master's, you get more skills, more knowledge, and then even better practices. So if you're employed at that level as a specialist, we think actually at that level you have more services and quality services you can offer the country. And even when you're promoted to a consultant and a senior consultant, and you fill up those gaps, actually a number of services actually improve. And we know that some of these referrals that we get in Mulago, they will actually start reducing, because those people will be filling up in those respective regional referrals. And I think it will be work well done by government, and we look forward to seeing better service delivery and better qualities, and fewer referrals to Mulago or to Kawempe, and they attended to there, and even the mortality rate, the death rates could reducing, and then even the patients who have been staying longer in the hospitals waiting for doctors, they won't stay longer. So I think there's actually more positives that we are waiting to see ahead of this recruitment.
Maybe also you can talk about the workload and patient satisfaction when we have these new people brought in.
I think the workload may be shared across, that if one doctor has been seeing 200 patients and they recruit 3 doctors, it means at least the workload reduces from 200 to around 70, which is actually quite good, and I know it may even go lower as time goes by. And I think the workload reduces, and then the quality improves, but also the other thing is that the patient satisfaction also improves. In that, if a patient came in the morning at 8 a.m., he was able to see the doctor after 1 or 2 hours, and he has been able to go to the different diagnostic areas like lab, the radiology department, and he has gotten his tests done in time. So that means even the patient satisfaction improves as time goes by. So I think there's going to be a lot of improvement. Me, I'm very positive, and I think since I've been in the field for some time, I feel for this time it is the long awaited, and it's like World Cup. It comes once in a blue moon, and it has come. So we think we shall celebrate.
Okay. We have been training people. And the nation has been training medical workers, and there apparently there was a ban. So can you elaborate much about this, can I call it disastrous aspect of unemployment to these people who are trained by the nation, but then you don't employ them?
Actually, if you were with us during our press release, we say that actually training somebody, especially health workers or doctors, and the government has spent money on this person. I don't know how much you spend, but it's a lot of money. And then after studying, and probably you have also enabled this person to do their internship. That is a low-lying fruit. It is, as I already said, it's a raw material that is readily available for you. Not even to pump around, but just to pick and put the right place, and you fix what you have. So if government doesn't employ such kind of health workers that on which they have spent money, it is actually money wasted. Why we say money wasted? Because if that person is not employed and is on the streets, is going to be wasting your money that is spent at school. Or if he decides to move on and goes to another country, that country is going to reap big, because most times we go to medical school, we are 19, by the time we finish we are around 24, 25, and actually that is the most productive age. Just imagine employing someone of 25 up to 40. That is the most productive age, or 25 up to 50. So if the government cannot realize that, my dear, that is making a lot of losses by not employing these people, no, we better wake up and employ these people. And most of these challenges that we are going through will come down as time goes by. And I think with the more industries they are setting up, we anticipate a number of challenges. And even recently, if you just realize, with the traffic we have, there are so many border accidents, and then you feel you actually have 70% of trauma patients in Kabweru apart from others, and you realize that actually most of them need to be attended to in the next 2 hours or 3 hours, but they keep up spending more hours there waiting to be attended to by the neurosurgeons and other surgeons. So it means that if we employ people, that means those people will be attended to in the optimum time of around 2 to 3, 4 hours, and we save very many patients. We also save resources, because when you keep delaying a patient to access another service, it develops complications. So by preventing complications, it means that actually you're going to save this person's life. But also, this person would have stayed in a hospital longer, like for 5 days, a week or also. But if he stays 1 day or 3 days and then he goes home, he's able to start also working and delivering for his family. So if we don't bridge the gap, it means we get complications, we lose so many people. People actually develop a lot of disabilities, and sometimes even the government loses, because now the person who was like riding a boda can't go back to ride. So that means he will not buy the fuel at the petrol station, he cannot afford to buy food for the family, and then he can't pay school fees. So the cycle keeps on growing. Yet if you attended to this person very fast, in 2 days the person can go back, able to work and continue using and paying taxes to the government, meanwhile also affording services for their family, and then also making sure that even their family gets the basic services, basic needs like education and the rest. Yes.
According to your statistics at the Uganda Medical Association, you have over 2,000 doctors who are unemployed. Isn't this number too much?
This number? But we don't know that, we know that actually the government needs more numbers. Like Mlago may be in need of 60 doctors. So if we take off out of the 2006, and then Mlago is one of the national referrals, Chirudu. So if we establish the gaps, the employment gaps, then we can always know how many. They think 2,500 is a small number. The total staff of Mlago may be coming to 2,000, most likely. If 1,000 or 2,000, or it is big. Just one hospital. What about the others? We may, if we did statistics and say, what is the current structure? What is the staffing norm? What is the gap? I think that is a small number to a country like Uganda. Remember, those patients actually would be attended to. Those doctors were attending to patients when we were still 20 million. But now we are close to 50, 60 million. Because we have taken some time without doing the census. So the numbers have increased, and we think that number can be absorbed by the government. That's what we think. But the government, I know with the time as we go along, they absorb some. We shall continue doing some surveys to see what the human resource gap is, and then keep updating the government, and then advocating for more absorption as we go along.
Also, over 2,500 public service doctors are awaiting, or they are ready for promotion. Do we have these positions?
Those positions should be available, because at different levels, they should be available, because 5 years ago you are not recruiting, people have died, people have moved on, people have actually, people have also retired. They should be available at different levels. And I think with that survey we did also some survey and established number of posts that are available. So they are available, and across the different cadres, the nurses, the doctors, the lab people, and the rest. I think that's even a small number, because those were estimates. We don't know where the government actually has. It may be in need of more than what even we anticipate or what we found out. So I think the government should be able to take up. If the resource envelope allows, they will take up as many as they can.
And during the press release, you did give a number of recommendations in regards to this issue. Can you highlight some of them for us here?
There were actually many, around 3. One of them we gave recommendation that let the directors of the different hospitals work along with the Health Service Commission to establish the gap they need, and then what they need to be absorbed, the staffs they need, which I think is already it's process, it's work in progress. And then 2, we actually recommended that actually Parliament should actually enact, should put up an act so that the issue of interns and residents comes to rest, because the truth is that with those few things that I mentioned that are not available, in terms of where they stay, what they feed on, and in terms of transport, you don't know what is happening in their life, and things have changed. Sometimes you can't just say strikes won't be there when you're not providing, and we want the government to commit that actually this is what we can afford and is available. But if you are, if you are unpredictable, then even the other one also becomes unpredictable. So we can't say nobody is actually very interested in industrial action, but everybody wants to be at peace. So the best is let the government actually get involved in the numbers that are taken up in different institutions in terms of training, but also by the time interns come, it shouldn't be a storm that, we have 2,000 interns. We thought we had 600. Where did the other interns come from? Let the government budget so that nothing takes them by surprise. Yes, so that at the end of the day, actually everybody is at peace. The government is at most peace. The doctors also doing their work. The interns are delivering. A 1 year like this is not as big as the 5 years they have been spending on money. And we shouldn't just leave that to go unnoticed. Yes.
Very, very interesting.
And then the other thing that actually is very key, that actually we are very supportive of the government, that actually that ideology, it came along with the parish development model, and then the assumption that actually they can take a doctor to those health center threes is one of our best, and we are waiting for it. We are waiting for the government to come up and say we have this budget and we are going to actually give them the doctors, and we make sure that they go to those health center threes so that they improve on service delivery. They also, the delayed referrals are not referred in late, and then even those patients who are referred, some of them are attended to at that level. We reduce on the mortalities, the death, the preventable death, and also we improve on actually the health of those people, because the wananchi are very important. They are the ones who are actually voting us into power, so we need them. And that's why we went to school. Wow. So we would ask government to also come up with that policy, and then we make sure that we mop up, and then we fill. So when we fill those gaps, just imagine we have a doctor at Center 3, at Center 4, district hospital, regional referral, national referral, specialized facilities. What a country I would wish to live in.
Oh, wow. Very interesting. Our time is really fast spent, and of course I would request you give us just in few seconds, lastly.
First of all, we thank government and the different stakeholders who have been involved, and obviously our mother ministry, Ministry of Health, Ministry of Public Service, Finance, and the government and other stakeholders, and even the media houses usually put things to the open, and it was also very good for the government to come up and open and say, we have this, and we also. And we know that the doctors are not called upon them that they go and get the job. The doctors have been preparing for 5 years, and I know they're already there, and they're just waiting. Maybe they are also on the internet already applying. So I'm very optimistic that actually the government should go ahead and implement this, but also go along to make it not one-off, but to make it regular, so that at least most of these gaps are improved, and we also go along to train people and then bring those super specialized services that actually are needed in this country, because the need is there. The patients are very available, and the doctors are available, and actually the few things that are not available should be provided, and one of them is funds. If funds are available, then they can move the human resource, they can move equipment, better infrastructure, and then better services will be seen in this country. So for God and my country.
Oh, wow. Thank you so much,
Dr.
Wilberforce, who is the Chair, Ethics and Professionalism and at the Uganda Medical Association. It has been a very, very big pleasure to host you and have you here.
Oh, thank you very much.
Thank you so much. Yes, we were discussing how the service would be enhanced because the government has just come out and lifted the ban on the medical doctors, which is very, very important. And of course, Dr. did us very well here to tell us what this will mean and what best services will come out of that. My name is Luke Majumba Naitwe. It's been Issues at Hand. Of course, we're powered by Protea Hotel by Marriott in Entebbe. Please go and check out on those people there waiting for you. Very, very good services, very good people to take you through the entire place, and of course the accommodation. You do not want to miss that. My name is Luke Majumba once again, and of course it has been Issues at Hand. Have a lovely day. Programming is continuing with very, very interesting programs here. Have a good day.
Issues at Hand, powered by
Protea